Thank you for inviting me to be with you today. It is good to have a chance to talk to you. I'm going to present a brief overview of World Vision's emergency response work. Emergency response is critical to World Vision's work as a child-focused organization. We know that children are often at their most vulnerable during and after an emergency, when basic services like water supply and healthcare break down, and education is disrupted, and when family and social caring systems are interrupted, leaving children exposed to harm. Emergency response makes up about a third of World Vision's work globally, and although emergencies don't always make it into the UK news, we are seeing that the number of emergencies is generally increasing, partly as a result of climate change. The World Vision Partnership responded to 76 emergencies last year in 60 countries. Through these, we supported over 36 million people, including more than 18 million children. The map on the screen shows which emergencies were supported by World Vision UK in 2023. These emergencies range from large-scale, multi-country responses like the Ukraine conflict to small local disasters. We respond to rapid onset emergencies like the Turkey-Syria earthquake last year and slow onset emergencies which build up over time, like the current drought in southern Africa. We are also responding to long-running emergencies over many years, which are usually conflict-related, like Afghanistan and Sudan, which is our focus today. Whatever the emergency, World Vision's global presence and experienced local staff mean we can respond quickly and appropriately to meet the most important needs of children who are often disproportionately affected by disasters. When an emergency happens, World Vision is often one of the first to respond and makes a rapid review of the needs and whether we have the capacity to respond to support those affected. World Vision is able to mobilize experienced staff and pre-positioned supplies to provide rapid assistance where it is needed most. Within 24 hours of a disaster, World Vision classifies emergencies into 3 levels to help determine the best way to respond. Category 1 is the lowest level, and these tend to be emergencies affecting a small area of one country. For example, a localized flood, storm, or fire. Response will be conducted by trained local emergency response staff. Category 2 emergencies may have similar causes but impact several regions of a country, and World Vision will manage the response through the National Office using trained disaster response teams. Category 3 emergencies are our highest category and could be caused by drought, storms, or conflict. They impact a whole country or a number of countries and often involve significant displacement of people and significant challenges, and the response could continue for up to 2 to 3 years. Depending on the context, these emergency responses often require additional support to a World Vision National Office, and the World Vision Partnership provides assistance through regional and international expert response teams. The Sudan emergency response is Category 3, which makes it one of the highest priority responses we have at the moment. World Vision's disaster management work generally follows this process. In most cases, we start with preparedness for World Vision staff, offices, and with communities. We develop plans to cover the most likely emergencies in the location, which may include staff training, pre-positioning supplies, or helping communities plan how they can cope if a disaster happens. Response. This covers the immediate, life-saving aspects of our work, working with communities to ensure access to food, water, shelter, and health services. This response phase may last from a few weeks up to a year or two, depending on the disaster. Governments have the primary responsibility to provide emergency assistance, so we always work in close coordination with governments to plan and carry out emergency work. Rehabilitation. Once immediate life-saving needs are addressed, we work with communities and government to look at rehabilitating and recovery activities to support communities to become more resilient to future disasters. This may include restoring or repairing buildings or water supplies, re-establishing education and livelihood opportunities, and disaster risk reduction work. And lastly, transition. World Vision usually makes a commitment to continue an emergency response until the needs are met. That long-term response is a strong added value of World Vision. At this stage, we may transition back into ongoing development work, hand over to another organisation, or could leave the allocation depending on the context. World Vision is a multi-sectoral agency, and we are able to support communities with a wide range of needs, from food to water to shelter and education and child protection. In each emergency, we assess what is most needed and where we can most effectively respond. As well as providing physical assistance, World Vision is also involved in advocacy in emergency responses, promoting appropriate policies by governments and United Nations organizations to ensure that children are protected and supported. We work in partnership with other humanitarian organizations and the United Nations to ensure responses are of high quality. One of our main partnerships in the UK is as a member of the Disaster Emergency Committee, which runs joint fundraising appeals in large-scale emergencies. However, we are generally responding even before the DEC is able to launch an appeal, and we will continue responding once a DEC appeal is completed. One of World Vision's key focuses is on work in conflict-affected countries like Afghanistan, Syria, and Sudan, which often face a repeated cycle of emergency situations. In these contexts, our programming work is flexible and adaptable to the changing context, moving between three types of programming. Survive. When the situation is volatile and there is an emergency, our work focuses on meeting the basic needs of children and communities and protecting children's rights. Recover. As the situation improves and stabilizes, our activities move towards rehabilitation, ensuring continued access to basic services, whilst looking at livelihood restoration and recovery from traumatic events. Thrive. When there is more stability, we focus on addressing the root causes of poverty and fragility, and looking at peace building, sustainable livelihoods, and strengthening local capacity. In Sudan, over the years, our programming has moved between these different types of work in different parts of the country and over time. But now we are focusing our efforts on the emergency needs in Sudan. And we're now going to show a short video which provides a further highlight of our emergency work.
Christine Barrett. Christine's role as Grant Portfolio Manager for World Vision UK for the past 11 years has involved managing humanitarian grants from the World Food Programme, the United Nations, and the Disaster Emergency Committee. Christine has a master's degree in global food security and development. Her continuing focus has been on World Vision's emergency response in fragile context, and her project management role has taken her to visit World Vision's work in the Democratic Republic of Congo, Cox's Bazar in Bangladesh, which is the location of the Rohingya crisis, Ethiopia, Kenya, Zimbabwe, South Sudan, and Sudan. Wow, Christine, you have traveled extensively with World Vision. Welcome and thank you so much for joining us this afternoon. If I can start by asking, how long has World Vision been working in Sudan?
So we first started working in Sudan in 1983, so over 40 years ago. And since the Darfur crisis in 2004, we've had a permanent presence in Sudan. So as David said, where it's appropriate, where we can, we respond and we stay. Many of our World Vision staff, the local team, live in the area and the country, and they've worked with communities for the long term, supporting them not just to survive, but to thrive. But of course, our ability to stay, even after the media have long gone, is totally reliant on our generous donors and partners.
That's right. And we are privileged to have our donors and partners joining us this afternoon. Christine, I've not heard much in the news about a crisis going on in Sudan. What is the current situation in Sudan and how urgent is it?
So the current crisis in Sudan has been escalating for over a year. The current situation is captured well on this infographic from our partners. And you can see the red symbols. Those are locations where violent clashes have taken place. And that's just since the 15th of April this year. 15,000 people have been killed in the recent conflict in these type of violent clashes. You can also see the light brown arrows on the map, which shows the number of people that are leaving Sudan, crossing into bordering countries of Chad, South Sudan, Egypt, Central African Republic, Ethiopia, Saudi Arabia, and Libya. And these are refugees. But in addition to this, there are people who have had to move from within their homes due to the conflict, but they haven't left Sudan. And they're internally displaced people. And as we saw in the quiz, in this Sudan crisis, we have the largest displaced people, including children, in the world at the moment. That's 11 million people and 5 million children included in that figure. So a short video from a World Vision colleague on the border of Sudan and South Sudan captures well the effect that this has on children and their families.
This is the Bulakat Transit Centre in Malakal in the Upper Nile state of South Sudan, which borders Sudan. It's currently hosting about 3,000 refugees and returnees, people who are escaping the ongoing crisis and conflict in Sudan. Now, I want to give you a sense of the conditions here. Because of the rainy season, it's extremely muddy, which is, of course, raising the concern of diseases like cholera. Authorities here are saying that 2 or 3 boats are arriving every single week of people who are escaping the conflict. We've heard very harrowing stories of people who have immense needs, especially related to their hunger. And of course, the journey from Sudan has been one that has been extremely difficult before they've arrived here in the transit centre, certainly displaying that well over a year after the conflict started, the needs continue and are immense.
So as you can imagine, every aspect of the lives of children and their families is disrupted through this. Driven from their homes and their land, they can no longer grow food, and their income stops very likely too. Hunger arrives very soon after. And with the conflict so widespread, little food is being grown, and food prices are unaffordable due to the huge increases due to the scarcity. So it's not surprising, but still shocking, that 25 million people, that's half the population of Sudan, are likely to reach a crisis point in food security by the end of September of this year. And 14 areas determined as having a risk of famine-like conditions. So as you would expect, families driven from their homes are telling us that food is their top priority. And they're also telling us that they need access to clean water. The health system has collapsed, so children are at risk of malnutrition and not receiving help they need to put them on the road to recovery. They're not attending schools because they've been closed since April 2023. So 19 million children in Sudan are being denied access to their education. Routine health, like vaccination programs, are no longer taking place. So diseases are more likely to occur. And the psychological impact of leaving your home suddenly and with the conflict takes a toll on mental health and well-being of people affected. The humanitarian situation is dire. And this is what's being said about the gravity of the situation. So the first is a quote from a resident of Sudan and a humanitarian coordinator who's saying, famine is closing in, diseases are closing in, the fighting is closing in, and there is no end in sight. And then a wide-ranging, sort of a high-level platform, World Vision represents as part of the NGO community, had no time to lose as famine stalks millions in Sudan amid intense fighting and access denials.
Wow. So with no time to lose, Christine, what is World Vision doing to respond to the crisis?
Thanks, Soreen. Yes, the World Vision is one of the largest humanitarian agencies currently working in Sudan, where we are saving lives. And we do this with partners in a number of tried and tested ways, in particular for children. So we're providing safe places for children to stay, to play in the locations that they are finding themselves, what they've fled to. Play is so important for their well-being, and you can see from the photos there some of the program photos. Child protection is really important because many children aren't accompanied by parents as they flee the conflict. So we're helping them to find their relatives and support them in other ways. We're also providing clean water through rehabilitation of boreholes, water pumps, solar water pumps, training on the importance of boiling water and of good sanitation to prevent disease spreading. For health and nutrition support, we're working with community health volunteers to actively find those children that are at risk of malnutrition, as well as supporting on vaccination programs and training and providing materials for skilled birth attendants to attend every birth. School meals have a really double effect of providing food, but it also encourages children to attend school and allows them to concentrate better when they're there. So you can see from that photo that the one there on the right is a recent photo from a program where you can see the children receiving their meal with the teachers and other staff at school. We're also providing seeds, livestock, goats and chickens typically, training farmers how to keep them healthy and reproduce. We're training farmers on techniques such as climate smart, making sure the most is made of every bit of water through tried and tested techniques. We're providing safeguarding services for women who are victims of gender-based violence in the conflict. Also helping to set up, train financial literacy and managing savings groups, because these really help communities to save and to reinvest in things that bring in an income. We're providing small cash payments for things like medicines that are essential and working on peace building initiatives.
Can you give us an example, Christine, of one of the partners who we are working with in Sudan?
Yeah, of course. So again, as we saw in the quiz at the beginning of the webinar, one of our partners is the United Nations World Food Programme, and we've worked with them for 31 years. And last year we worked in 31 countries together, including Sudan, where we're one of their largest partners. World Vision distribute food to children and families. Many of these are in really rural areas that we wouldn't be able to access without support of the UN because of the conflict. Every month we provide pulses and sorghum, which is like a local cereal, which you can see in the photo. Sack of it's being carried. Oil, salt. This is life-saving food taken to the most needing it. And we reach communities who have fled the conflict to remote and rugged areas, sometimes such as the Nubian mountains, which are really challenging to reach, especially in the rainy season. But as well as food, we provide a very high calorie, very nutritious plumpy nut supplement for young children under 5s who are showing signs of malnutrition. And this has a really good evidence and really good history of excellent recovery rates when we use that. And just to show a quick video of of people in the community waiting for food to be given out in this setting.
Christine, the situation is very drastic. 5 million children. I mean, what gives you hope in this dire humanitarian situation?
Two things give me hope. First is the work we're already doing and the stories that we've already heard of the impact we're having in Sudan. And one of them I can share with you now. So this is a picture of Rhoda and her daughter Nisrin. World Vision is working through mothers groups who regularly visit households where children live in this remote area. They live in East Darfur. In January this year, Nisrin, who's 14 months old, was diagnosed with malaria and severe acute malnutrition. Her mother Rhoda told us, I had little hope. My daughter's condition was getting worse, and our ability to provide for her was strained. But through World Vision's work, Nisrin received immediate treatment for these potentially deadly conditions. And her mother, despite the challenges caused by the conflict, brought Nisrin to her appointments every week for weighing and to provide this very nutrient-rich therapy every week. Her health steadily improved, and within a month, Nisrin had progressed from severe to moderate malnutrition. And 56,000 other members of Nisrin's community have benefited from that health service provided by World Vision, whether it be vaccinations, reproductive health care, as well as that type of vital nutrition as the one that Nisrin received. And secondly, I've got confidence in my World Vision colleagues because they have huge knowledge, expertise, skills, and learning from previous recent crises, such as the one in East Africa, which they're applying to this crisis. And a short video of one of my colleagues explains this best.
Famine is much more than hunger. Malnutrition itself is deadly, especially in infants and young children, whether they're dying from the starvation or from preventable diseases that weaken their bodies, which cannot fight off infections. Children's education is affected because they cannot go to school when they are hungry. Conflict spreads in famine areas and other places where food resources are scarce. People are displaced from their homes and lose their means of earning a living. The children who do survive famine will live with the consequences for the rest of their lives. Their growth will be stunted and they will be at greater risk of dying from future illnesses. They also tend to have a higher risk of having underweight or premature children, passing these consequences to future generations. 3 conditions need to be met before famine is declared. 1 in every 5 households in a certain area must face extreme food shortages. 2, more than 30% of the population of a given area is acutely malnourished. And 3, at least 2 of every 10,000 people die each day. Once a famine is declared, it is usually too late. Children are already dying and the situation is already devastating. Every life matters. No child should die of hunger. The international community helped to avoid famine in East Africa in 2017 because it took early action. We need millions of dollars urgently to scale up our response. We've begun with giving them immediate assistance through distributing cash. If the public support us, if we get more partners to come on board, we can reach out to this community and give it more access to food. We can at least provide immediate health assistance to ensure that at least no child dies in this community because of lack of food or lack of water.
Thank you so much, Christine, for sharing your knowledge and your experiences with us.
A pleasure. Thanks.
What stood out for me in the video that we just watched is our colleague saying that every child matters and no child should die of hunger. And we need more partners to come on board. I'm having a look at the chat box now, and we don't have any questions that have come in yet. So please do type in any questions that may have come up as you were hearing from our colleagues. Thank you so much to those of you who have already given generously to our Sudan appeal or to our emergency fund. If, however, you haven't been able to give yet and would like to, there is an opportunity to do so via a link in the chat box, or you can scan the QR code that is on the screen at the moment. For donors who prefer to donate via bank transfer, please do let us know and we can share the details. You too can become a partner in supporting our truly life-saving work in Sudan and in other emergencies across the world. Last year, World Vision UK responded to 21 emergencies in places like Ukraine, Syria, and several across sub-Saharan Africa, Bangladesh, Venezuela, and Zimbabwe. So, oh, we've got something in the chat box. Okay. All right. So we've got some questions. Thank you so much for the questions that are coming up. I will give this question to David. There's a question here from Helen Gray. David, if you can turn your video on. And Helen is wondering why the situation in Sudan isn't getting adequate press coverage.
Hi, Helen. Thank you for your question. I think it is a very good question considering the scale of need. I think there's probably two things I would point to. I mean, firstly, a lot of the international reporting is focused on conflict in Gaza. Obviously, that's another long-running situation. But I think with Sudan, because this has been escalating since April last year, sometimes the media can get tired of a story and move on to the next thing. When our World Vision and our partners are doing what we can to raise the profile and awareness as much as we can. Thank you.
Thank you, David. Okay, let's have a look. In what ways? We have another question here that's come up that I'm going to read out. In what ways could increased financial support from donors help prevent the situation in Sudan from worsening and possibly leading to a more extensive regional crisis? David, I think I shall perhaps call on you to answer this one, as again, this is your area of expertise. David, are you able to turn your camera on and come back for us? So I'll read the question again. So in what ways could increased financial support from donors help prevent the situation in Sudan from worsening and possibly leading to a more extensive regional crisis?
Yeah, so World Vision is working with the institutional donors that we work with, like the UK Foreign, Commonwealth and Development Office, the United Nations and other government donors, as well as through support offices and our public supporters to see how we can raise funds to support those in Sudan who are affected. I think it is critical that all donors step up, and that's what we're asking for, with our advocacy work, to say, people are dying now, urgent needs are here. We need to respond before it does escalate and get further. And so the more work is done now, the fewer people are likely to leave as refugees to neighbouring countries as well.
Thank you, David. There's a question here from Temi. She says, thank you for sharing. This is really insightful, and I apologize if I missed this earlier, but how does World Vision ensure the resources get to the most vulnerable, especially the children? Christine, if you could turn on your camera for us and respond to that one. How do we ensure that the resources get to the most vulnerable, especially the children?
So this is something that World Vision are really experts at. Working with communities, we agree with them a list of criteria which is going to prioritise the food and other items that are going to be given. So we do that with the communities, agree the criteria, and then once we've got those criteria, we then go through literally household by household to see whether they meet those criteria. So we come up with very, sort of very systemized, very agreed sort of lists of people that will be benefiting, and they will be, because of the criteria, they will be the most vulnerable, like people with disabilities, widows, child-headed households, and these kind of very vulnerable people.
Thank you so much, Christine. We have a question here. What is the estimated funding gap? It is in the millions of pounds, millions of dollars. And the question goes on to say, how can additional donations make a significant impact in the current situation? How I can respond to that is, you heard Christine talking about our partnership with the World Food Programme, and additional donations can really help us to maximize our response. As you saw from some of the videos that were shared, the urgent need really is for food and assistance to children and families that have fled the crisis. And so we are the largest implementing partner, as you heard, for the World Food Programme, and any donations will enable that life-saving food to reach those people who need it mostly. No child should die from hunger. I have a question here. It says, how do you measure hope in a crisis like Sudan? And how can donors be the ones to bring that hope to those who need it most? How do we measure hope? Christine, maybe if you can just in 1 minute, just summarize a response to that question, please.
I was talking to the team in Sudan last week. There is a feeling, what can we be doing to help them, and how I always want to know how I can support them personally. But I'd say that when they know that donors are supporting them and we're supporting them and we are speaking to our government or whatever advocacy work, as David mentioned, we're doing, they really appreciate it and feel that we are supporting them sort of financially and through other support as well, just being there really for them and appreciating. I always really appreciate them when we're working with them and thank them for everything they're doing. It's a really, really challenging context, and what they're doing is absolutely amazing.
Yeah. Thank you so much. A World Fit for Children is the name. Thank you so much, everybody, for joining us this afternoon. We hope you've been enlightened on the crisis and our work in Sudan, and you've been inspired by how your donations can make a significant impact on the children who need it the most. Many of you will have been invited today by your dedicated member of staff. Please feel free to reach out to them if you have any follow-up questions or you'd like to know more about anything that you've heard today. We would be delighted to share more and have a further conversation with you. When you leave the webinar, we do have a short survey that we would appreciate if you could complete for us. We're always looking to see how we can improve our webinars. And we also have a link. We are asking if you could please sign a petition that we are petitioning the UK government to be champions for children and to allocate more of the foreign aid budget to children. So please, could you click on that link as well? We'd really appreciate it. We need more voices. We need more people to sign that petition so we can hand it in. And we are bang on 12:45. So thank you once again for joining us. I look forward to seeing some of you at another time. And thank you so much for your support of World Vision's work. And we look forward to seeing you again at another time. Enjoy the rest of your day. Thank you.